Standards are important. The World Wide Web has a common language. That is why it can be such an open, rich, innovative platform. A global communicating network. We can apply that principle elsewhere. We can and we should, by ensuring the maximum possible open standards, open platforms and interoperable systems. Healthcare is a case in point. The world is getting older. We all know that. You can't underestimate the impact on society. According to many, it is the biggest single trend over the coming decades. That means our population will need more care, but also a different kind of care. We need to rethink how we provide it. More personnel, more flexible, more empowering, more patient-centered, provided not just in hospitals and institutions, but at home and on the move, allowing people to stay active and independent for longer, and focus not just on cure, but on prevention and healthy living. And that's what people want. That's what the economy needs. And amid this change, there is a great opportunity to improve the lives of millions of our older citizens and to tap into a global silver economy worth around 3 trillion euros. Silver is the new gold, and that is why we have invested significantly. We have invested financially with EU research and innovation, providing 7 billion euros for health, well-being and active aging in the upcoming years, and we have invested politically with action plans, joint programs and innovation partnerships, getting thousands involved to build a better Europe, with new forums for partners and European regions to get together, share ideas and swap experiences. But that will work so much better with the right standards. Standards mean more choice, more competition and less lock-in. They mean more innovation as ideas can build on and work with each other. They lower the barriers to entry for suppliers, giving a rich new area for Europe's army of startups to innovate, giving Europe the competitive edge in this emerging economic sector. And they mean systems can work across borders, so patients get less hassle and seamless service even when they travel abroad. And so the market can expand across Europe with continental economies of scale. Imagine if we could offer, for example, a personal health navigator for our people, a user-friendly tool helping people find and interact with their nearest doctor, pharmacy or hospital, with accessible and trustworthy health information, quick and secure access to their personal data should they need it, helping them detect diseases and support their treatment, but also to stay healthy so disease doesn't set it in the first place. All accessible and easy to use, available wherever and whenever they need it. That would be a great thing to deliver. And that's exactly what I've called on partners to do. So you have picked the theme well. Standardization to support the silver economy. Standards, technical and semantic. In this area, a lot has already been achieved by you and by us through our work on EPSOS, Expand, the eHealth Stakeholders Group, Semantic Health Net and the eHealth Interoperability Framework, to name just a few. But there is still a lot to do. Even when there are interoperability standards in eHealth, they are not used enough. Some still can't be used in public procurement. And I want to promote the use of international standards, with procurers saying more explicitly how they want eHealth solutions to work and interoperate. Projects like Antelope are making this easier, looking at and testing out issues like interoperability labels and certifications. And we are also working with the US with a joint roadmap on requirements and commonalities for standards. We could even launch international standards, something we are looking at with projects like the Trillium Bridge. Most of all, we need a shift in mindset. Having new tools, devices and apps is one thing, integrating them across the health system so people can benefit from them everywhere, large scale, that's quite another. It takes effort and dedication and the will to change. I call on you to help us get there. My dream is for Europe to take the lead in a new, vibrant market, helping our people and boosting our economy, with every citizen digital, connected and healthy. Standards and interoperability are essential for that dream. I hope your contribution can make it happen.